Hi friends, I am Dr. Toishi Sharma, Interventional Cardiologist in USA, and today we are going to talk about a very important topic, that what percentage of a heart blockage is considered dangerous. So friends, let's dive right into it. So we divide the blockages into mild, moderate and severe. Anything from 10 to 40% is mild. Anything from 40 to 70% is moderate, and anything above 70% is considered severe. So in generally, if we see a blockage that is more than 70%, we say that this is significant coronary artery disease, and we should do something about it. There is still a difference between a 70% blockage and a 95% blockage. As you can imagine, both are severe blockages, but obviously a 95% blockage is more at a risk of complete occlusion. The question is, how do we approach them? Now, if we see a blockage that is mild or moderate, that is anything less than 70%, our recommendation is to maximize medical therapy first, which includes aspirin, another antiplatelet like clopidogrel or Brilinta, as well as a cholesterol medication, because these medications stabilize the blockages, prevent them from worsening and causing a heart attack. We can also recommend medications that help to dilate your blood vessels and improve any symptoms like calcium channel blockers and beta blockers. Let's talk about the approach to treat a severe blockage. What to do if you have a severe blockage? So friends, there is no one size fits all. The first thing is to see what is the presentation. If a patient is presenting with a heart attack and has an 80% blockage, then we recommend going for stents or surgery to fix it right away. Because if a heart attack has already occurred, we don't want the blood vessel to get completely occluded. However, if a heart attack has not happened and if we find a 80% blockage, then it depends what the symptoms are. If the symptoms are occurring, once or twice a week, meaning they are stable symptoms, they happen every time you exert yourself and then they go away, then we still have time to try medications and we don't have to necessarily rush to put stents. Because studies have shown, especially the ischemia trial has shown, that putting stents in all severe blockages is not necessary and it does not change patient outcomes. So, even if you have an 80% blockage in one of the blood vessels and your cardiologist has recommended trying medical therapy first, it is completely safe, my friends. Now, there is two caveats to that. First is, if the blockage, the severe blockage, is in the left main artery or proximal part of the LAD artery, then we still recommend doing something about it with stents or surgery, because we think this is a high risk territory. It's supplying blood to a large part of your heart. So in most instances, we do not want to wait for medications to work. But if the significant blockage is in another artery like RCA, circumflex, or distal part of the LAD, in that case, we can safely treat you with medications if you are not having unstable symptoms. The second caveat, my friends, is that if we try you on medications and the medications don't work, you're still having pain, then we definitely need to put a stent or do surgery. Or sometimes we find a blockage, we start person on medications and they feel well, the pain goes away, they are doing great. But maybe 1 year later, they have pain again. So in that case, if we have maximized our therapy, then we can say, okay, we tried the therapy, but patient is still having chest pain, so let's go ahead and do the procedure for stenting or surgery. So friends, it really depends person to person and their comorbidities as well, because before doing invasive procedures like catheterization, we have to consider what other comorbidities are there, if there is kidney disease or not, because contrast dye can damage the kidneys, if there is history of stroke or not, because stroke is one of the risk factors for catheterization, and if there are any contraindications to antiplatelet medications, because if you have bleeding issues, then if you get a stent, you have to take 2 blood thinners to keep the stent open. So all of these considerations are also there, my friends. So I hope you like this video. And if you have any other questions about blockages, please feel free to comment in the comment box and we will make a video on that. Thank you and have a good day.